we got a conversation going on here. What? Yes, remember that. Sub is like a submarine. They go underwater. Sub is lower. It holds that ST lower. Okay? It's higher. It's the other one. See? There's lots of them. Dude, there are a lot of different kinds. You can learn all about those in nursing school. You'll learn about all sorts of EKGs. Like 9 pages of them. Okay? So, Anna, 23, is having a night out with her friends in the area nightclub. Unfortunately, she is having trouble keeping up on the dance floor, and so she keeps having to excuse herself to the restroom. On one of these occasions, she is shocked to find that her urine is bloody. Not wanting to ruin her night, she contributes this latest development to too many drinks. In the morning, however, she is feeling more than the usual post-party grogginess. In addition to the bloody urine that has not gone away, Anna is experiencing pain from her abdomen to her groin. She keeps feeling that she must go to the restroom even though she has gone many times today. She goes to the doctor who tells her that her bladder is inflamed and that this is possibly an autoimmune condition. Best diagnosis?
D.
Uh-oh, we're all over the place. Who said B? What is good pastor syndrome? Do you guys just happen to know what that is?
No.
Well, then don't pick it. You don't know what it is, don't pick it.
I don't think it's neurogenic either. Are we wrong?
I don't know, what did we come up with?
D.
Interstitial cystitis? Remember that one? That was the one where the bladder wall itself was very thin. You had those Hunter's ulcers that would pop out of there. You couldn't stretch the bladder because the wall was so thin. Because there was something that you could find in the blood that made the wall thin. What was that factor? Anti-proliferative factor. Remember that? Remember anti-proliferative factor in interstitial cystitis? All right. Kayla is a 48-year-old woman with a habit of smoking almost 3 packs of cigarettes a week for the past 30 years. I know. Recently, she complained of chest pain and being short of breath while out on her daily walk. Being the worrisome person she is, she went to her doctor for a checkup to run some tests to make sure nothing was wrong. Her doctor examined her body and noticed some abnormal heart rhythms as well as prominent vessels on her neck. He ordered a chest x-ray to be taken, and it showed her heart to be slightly enlarged and moist. She had a BP of 142/98 and a pulse of 123. Kayla also remembered she had some swelling in her legs and feet the day before, but didn't think it was significant due to her desk job. Based on the signs and symptoms Kayla is presenting with, which is her most likely diagnosis?
C.
That was terrible. They're options.
What?
All the other ones are like respiratory.
Well, B.
Well, she has
You
smoked
can
for
get
30
B
years.
too. Okay, what is it?
All right, so what they came up with is chlorpulmonale.
Is it because of the jugular, huh?
Yes. They were going with, because she has probably one of these COPDs, either chronic bronchitis or emphysema, because she smoked for so long, they're going with, she had prominent vessels on her neck. I think they are trying to say in a different way, jugular vein distension. Hey. Okay? Keep in mind, your patients do not know the phrase jugular vein distension. However, you might be able to see that, right? And that's what they were going for. They went with Corpomin. Yes. I would have said the same because I would have recognized that prominent vessels on her neck probably meant that. Also, it's kind of significant that somebody's been smoking for 30 years and they're only 48.
Oh, wow.
3 packs of cigarettes a week.
Wow.
That's not that much, actually.
That's not that bad. I mean.
Yeah. I know what you're saying. It's not good, but it's not 3 packs a day, right? Anyway, questions? Oh, great. A 53-year-old woman who has bypass surgery in her 30s because she had coronary heart disease due to obesity begins to complain about some discomfort in her arms, neck, and chest, period. She's now 149 pounds and has intense workouts 4 times a week. She feels the pain increase and nauseous when she exercises. Worried about it being a complication from the surgery, she goes to the doctors. They perform a physical examination. Her EKG showed no abnormal patterns. The doctors then took a coronary angiography to see if there was anything wrong in the heart. Results came back showing some blockage in the vessel. What does the patient have?
I see. I think it's C.
Honestly, it's really weird to read her out those patterns.
Does it say? It never says she feels like it's
I think that's what
They say it is angina pectoris.
Yeah, that's what I would think too.
Okay? They say it is angina because of the fact that probably there's no abnormal patterns in her EKG.
Yeah.
And that pretty much settles it more or less for having a heart attack right there. Yeah. Questions? All right. That was hard to read.
It was the spacing made it all look funny.
Yeah. A 64-year-old male named Robert lives a relatively healthy lifestyle. He is happily married and enjoys walking his dogs and playing golf. His wife has noticed that he has been extremely clumsy lately, tripping over himself, and has trouble doing simple tasks such as walking. When he visits his doctor, he explains he has been feeling weakness in his feet, which is making it hard for him to walk.
Oh, AOF.
He also explains he feels weakness in his jaw. The doctor asks him to swallow, and he says he has a hard time doing so. The doctor checks his vital signs, and they appear normal. The doctor then checks Robert's reflexes that were all normal, with the exception of platter reflex, Kavinsky sign, with his toes spread and extended. The doctor decided to have an MRI, electromyography, as well as a blood test. Robert's serum is abnormal with elevated levels of glutamate. What is Robert's likely diagnosis?
ALS.
Based on?
It started in the extremities, and because of the glutamate.
Okay, what? Fair enough. It started in extremities, and because of the glutamate, sounds like ALS to me. Kelsey, a 40-year-old, has been complaining of arthralgia, fatigue, constantly feeling cold, and difficulty concentrating for the past couple of months. She also hasn't been working out because of her fatigue. She hasn't been eating a lot, but continues to gain more weight. She went to the doctor and took some tests. Her lab results showed a decrease in T3 and T4 levels with elevated TSH and TRH levels. Her temperature is 36 degrees Celsius, 37 by the way is normal, and a heart rate at 67 beats a minute, which is fine. RBC levels were normal, and RBCs were normocytic and normochromic. Kelsey's diagnosis?
C.
Hashimoto?
Mm-hmm.
Okay. Questions about that?
No. No question.
What? Arthralgia means your joints ache. 16-year-old boy named Jason is a sophomore and the star quarterback of his local high school team. Whenever there's a game coming up, he and some of his teammates always dab into a little cocaine 30 minutes before because
Oh my God.
and bumps them up.
Oh.
Yeah, right? Unless you finish that sentence with right. Something that you would write. Anyway, during the game, Jason experiences excruciating chest pain and difficulty breathing whenever he exerts himself and becomes weak and unsteady, unable to stand. His coaches sent him to the hospital right away. Upon arrival, doctors and nurses immediately performed an echocardiogram and chest x-ray and noticed Jason has 2+ pitting edema to his knees. The results show that Jason's heart is not normal, specifically the walls of his ventricles. The walls of his ventricles have become thick and stiff. What does Jason's condition?
B.
What's wrong with Jason?
B.
He's done.
Ooh, I heard.
B.
Actually, I think I heard A, B, and C in that. What you guys are screaming out.
Hypertrophic.
Oops. Okay, they put no answer. So let's justify him. You say B because why?
Because his heart,
Ventricles have become thick and stiff.
so they've gotten bigger.
Hypertrophic.
Yeah.
Ventricles have become thick and stiff.
Yep.
Hypertrophic.
That by definition does mean,
Hypertrophic.
well, thick means hypertrophic, stiff means restrictive.
I'm sure.
But that's not a choice. Did he have a heart attack?
Mm.
I mean, they did an echo. They didn't mention anything about other than a thick heart.
And pitting.
Pitting edema, obviously the heart isn't working that great, so it's probably not angina,
Yeah.
right? So again, this, I think they were probably going for what you guys said, hypertrophic cardiomyopathy. Can cocaine cause that?
I have no idea.
I've never tried. No.
I guess it could cause it if you
Because
do a
of
lot of
drugs,
it because
yeah.
of the sympathetic response all the time.
Like every day though, right? I mean, obviously you shouldn't be doing cocaine and then go running, but.
All right. So we will pick up the rest of these on Monday.